following show is a paid program.
Family, I'm so glad you are with us on today. I thought today would be one of the best ones to talk about breast cancer. It's Breast Cancer Awareness. The month starts in October, but we are going to start today in speaking on it. On today, we have JANICE WORKCUFF, Executive Director and founder of Angel Surviving Cancer, and Dr. Richmond with us on today. Hey, ladies.
Hey, thank you so much for having us.
Man, I'm telling you,
Thank
I
you.
am very, very excited about today because I know we're going to give information to women all over the world, really, just to let them know about what breast cancer is, what it looks like, and how it's prevented. How can we prevent this? Let's start off and let's say to both of you, thank you, that you're taking out your time and the opportunity to give the awareness for breast cancer. I know it starts in October, but breast cancer is every single day. I know Janice can attest to that in what we speak about. But let's start off. Janice, why 32 years later, why still work for breast cancer and try to advocate? Why so?
I think that is so, and first of all, thank you so much for having us. And Dr. Richmond is one of our advisory board members. Thank you so much for having us. I think that it's just so important to be out there and to be an advocate for these ladies, making sure that they're getting the right information, helping them through this journey, and then just teaching them how to take better care of themselves. That's just so important. I just love doing that. I love talking to them. I love guiding them. I love giving them encouragement and giving them hope. I like doing that.
Absolutely. 32 years ago, you were diagnosed. Let's go back to that day.
Wow. 32 years. It's just nothing short of amazing. Yes. Wow. Yeah, it is. Going back to that day, every time the Lord allows me to say this story, it's still healing for me, even after 32 years. I was wrestling with my son. He was 5 years old at the time, and he accidentally hit my breast, and my hand landed on something that was different that I'd never noticed before. And I was aware, first of all, there's something that's important in your body. I never had any problems with my breast. I never had any kind of lump. So I knew at that time that something was different. And so I immediately followed up with a physician. I was 32 years old. They did a mammography, and it came back that it was suspicious to follow up in 6 months. 6 months just did not sit well with me. I was working for a breast surgeon at that time, and I asked him, I said, would you just do a biopsy just for my own comfort? And so he did a biopsy, and it came back that it was indeed breast cancer. I was very, very devastated. It didn't run in my family. I didn't know a whole lot about it. It was kind of taboo at the time. People weren't talking about it. So this is something you think happens to somebody else. You know, it was just really, 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 really hard for me. So I had the mammography, and then he suggested that I have a modified radical mastectomy, or either I have a lumpectomy. If I knew then what I know now, because it was 2 centimeters, it was in situ, DCIS, which means it was just right in that place, I would have had a lumpectomy, but I had a modified radical mastectomy. I can since have a reconstruction, and I had that surgery, and I did well. I did very, very well, and no margins or anything was found, and I went back to work trying to get back to some normalcy of life. And then about 3 months after the surgery, I woke up and something was wrong. I was aware again. I'm keeping in touch with my body. That something was going on. My chest wall was swollen. It was red, and so I'm back at the doctor again. And I asked him, would he do well, at that time he did a needle biopsy in the office, and a couple days later, he called back and said that it was a reoccurrence into the chest wall. and that the days of my life would be very short. I thought that was just devastating for him just to say that straight out to me. I was just ready to fight. I was ready to do whatever I needed to do. At that time, they hit me with chemotherapy, 5-FU, Cytoxin, and Adriamycin, some very, very harsh drugs back then. I was very, very sick. Sometimes I couldn't walk and sometimes I couldn't talk. But I just thank God that I had great support from my husband and my family, all the people around me that helped me to get through that. And then after the chemotherapy, then I had the radiation. And then I did very, very well, went back and had the test done and everything was clear. And so this doctor retired about 30 years ago and they invited me to his retirement. So I got a chance to go back and tell him that the days of my life have been very long. My days have turned into months and my months have turned into 32 years. And I'm so grateful for that. I am so grateful for that testimony. And I just tell it wherever I go, wherever it can help people, help young ladies and help them just fight. I didn't want to just live. I wanted productive living and quality of life. So God can continue to use me because people are living and don't even know it exists. So I wanted to be able to still have productive living.
I love that. Dr. Richmond, jump right in here. You have dedicated your entire life to helping others by being a medical doctor. And you hear these things all the time, or you see this. Let's talk statistics, specifically with African American women. With African American women, so they can say these are things that we see as a people.
So as a people, particularly for African American women, the incidence, I would say overall of breast cancer have gone down. However, we continue to see that Black women are found to have breast cancer later on in the diagnosis and the process. We see that Black women are more likely to die than white women. In fact, a 40% increased chance of dying from breast cancer. The same breast cancer that a white woman would have, if a Black woman has that breast cancer, that type of breast cancer, she's 40% more likely to die. And so these statistics are stunning. And then also, as Ms. WORKCUFF said, she was diagnosed early. And we're seeing that a lot more in the African American community, where younger women are being diagnosed with breast cancer earlier on. And then sometimes we're also actually being misdiagnosed. So that's a whole nother discussion. But it's important, as Ms. WORKCUFF said, she really advocated for herself. And so what I recommend is that we advocate for ourselves, because we're getting left behind. And I know we'll talk a little bit about more aggressive cancers, but we're also found to have the more aggressive cancers that are harder to treat.
Let's look at this. I noticed one thing about insurance. If you have insurance, okay? If women, African American women, have insurance, and many are uninsured, many times they will not even diagnose you or look. Is it mammograms, or are they at 40? Or when do you start at your mammogram? When do you start?
Mammograms are mammograms are started at 40 years of age. There are some organizations that say 50, but because for me personally, because I work in a high risk population as a primary care physician, it's very important that early diagnosis is key. Screening is key. So screening means that we're checking before there's an actual diagnosis, and then also being more aggressive if a patient comes in and says that they feel something just isn't right. And then also, if you have a family history of breast cancer, as I do, my grandmother was diagnosed when she was 42 years of age. That means that 10 years prior to when your relative, your first degree relative, was diagnosed, you should be getting a mammogram. And at the very least, having a doctor do an actual breast examination when you come into the clinic.
What I heard from Ms. WORKCUFF was this: if she had waited until she was 40, okay, she was 32. I understand, Janice, you were 32.
I was
40, okay, and at this point, insurance is saying you start with your mammograms, and they'll start paying and things like that. I hear so many times that they miss it with African American women specifically. We're dying because of that, the age. And Janice
So
wouldn't be here. She
it's
said 32.
correct. And that's why I say advocate for yourself. If there's something that you feel or something that you're concerned about, because we want to look at relative risk and we want to look at number needed to treat. That means that how many people does it take to get a positive result out of all the people who would be negative in getting a test, let's say at 30 without any symptoms. And so that's the purpose of screening. However, if you feel something, if you're concerned about something, the 40 age recommendation is pretty much out the window, because we have to look, we have guidelines, but we also should be, I should say we also look, because not everybody does this, but we should be looking at the symptoms and making a clinical decision with the patient on what is the next best step. So that's the 40 is not a one size fits all recommendation.
What I've also noticed too is that in reading just some of the information, a lump is not always the thing. It says you may have breast cancer even if you don't feel a lump in your breast.
No, absolutely. So other symptoms of breast cancer, a lot of times, even if you have a lump, it may not be painful. It may
Right.
just be something that, you press in it, you feel the lump, but you don't feel any pain. Nipple discharge, nipple bleeding. Sometimes it first presents as a bump under the arm. And I've had so many young women that come
Yes.
in and that's the first thing they notice, right? Like I shave in that area and all of a sudden I just feel something different. And
Yeah.
that's because if there is something going on in the breast, it drains to the lymph nodes in the armpits. So there's all different presentations, and you're correct. Again, if you notice a change in your body, you have to advocate. And so having a recommendation of getting mammograms sooner sometimes can bring what we call false positive results, leading to more biopsies and things like that. However, again, in the African American community, we have to be very astute to what's going on for the patient and for the doctor.
Absolutely. I love that. Janice, jump right in here. I want you to speak to the women about feminine part, because a lot of women feel if they go to the doctor has said remove their breast, they feel as though they've lost that part of femininity. Let's speak on that and let's tell them that as you did part, but you had reconstruction.
Yeah, absolutely. That was very hard on me because that's a part of the body that we think that I thought defined me as a woman.
Yes.
But that's another loss. It's almost like a grief to lose your breast. And yes, I have had reconstruction. I do feel better and things like that. But that's not defined us as a woman. And if it's going to save our life, I think we have to think about that. But as Dr. Richmond said, just being aware that something is going on, taking care of your body, something is different. Like I say, I was in the medical field, so I was working for a breast surgeon, and I went and asked him, can you do this for me? And he said, yeah, for the comfort of just knowing that. But that part there was very, very hard for me. It was losing the breast, just accepting that. That's very hard.
Absolutely. Dr. Richmond, I want you to step in and speak on this too about breast. And let's talk to women, because many times that is really a reality for them. That's why many don't go. I will say that.
Exactly.
Yeah, absolutely. And so I want to say for my grandmother, again, she was diagnosed when she was 42 years of age, and she, like Ms. Workoff, had a bilateral radical mastectomy. So she had both of her breasts removed. She was only in her 40s. Her kids were young, and she did not have the opportunity to get reconstructive surgery. I'm sorry, y'all. Reconstructive surgery. But she had prosthetics.
Yes.
And she made it known to me as a young girl that this is okay.
Yes.
That she was still a full woman.
Yes.
We have a lot of different, feminine body parts that sometimes have to be, have surgery and parts removed and all of these things, but
Yes.
it doesn't make you less of a woman. I think it makes you more of a woman when you can kind of face exactly what's going
Yeah.
on.
Yes.
And being able to come into a doctor and say, hey, I know this is what's going to happen. I don't feel comfortable with it. And having those conversations. And so also having conversations about mental health. A lot of times we miss that part. But this is, just think about, you have to potentially have all these treatments. Your lifestyle is not the same. If you're a working woman or working mom, or because being a mom is work,
Yeah.
it's a whole lifestyle change, right? So you need to make sure, and make sure that you have the support around you. And that may mean saying, hey, I need to talk to somebody.
Right.
I'm
Yeah.
not feeling this. This is not what I planned.
Yeah.
And we say God's plan is not always our plan.
Right.
So
That's
sometimes we
it.
have to adjust. So
Yeah.
it's so important to take
So
your
important.
health care into your own hands,
Oh,
because that's what I think makes you a woman,
Exactly.
yeah.
and that's my
Well,
personal opinion.
I know. Well, from a man's point of view, guy here, so I'm going to tell you ladies, so I'm shout out to the queens out there to let you ladies know, we as men want you alive. We're
All
very
right.
aware
All
of
right.
health.
Yes.
We're very aware of health. And let's talk about men can get breast cancer. I know we call it chest cancer. A lot of men say it's chest cancer, Cameron. It's not breast cancer.
Yeah.
But let's say that there's several men that have had chest cancer.
Yes. And so we know this became on the forefront when Beyonce's dad
Yeah.
was diagnosed with chest breast cancer.
Yes.
And even Ms. WORKCUFF, on our last in-person brunch, we had fundraising brunch, we had a young lady speak on her dad's behalf who had chest/breast cancer. So it can certainly happen. And again, for our men, if you feel something wrong or you feel something different, go see the doctor. Now, I think men, Cam, I don't know, but I
Yeah.
think men might be a little bit harder than women
It's hard. It's hard.
to
It's
get
hard
y'all
for
into
us.
the office to
Hard,
tell
yeah.
the truth.
It's hard. It's hard. We
Okay.
can't talk to our friends, our boys, and say, "Hey, we got some
Right.
chest or breast cancer."
Yeah.
Right,
All
right.
right.
No, absolutely.
Yeah.
But if you feel something or you notice something, please see
Yes.
at the very least see your primary care doctor.
Exactly. Exactly. I wanted to bring that up, and I wanted to let men know it's okay. You know, men as well as women to say, "Hey," to their men, "Hey, if it's something going on, you got to go." You know.
You gotta go.
Yeah, you got to go.
Yeah, you got to go.
Absolutely.
You got to go. Let's go back to the Angels Surviving Cancer, the nonprofit.
Hey.
How did that start, Miss
Hey,
Janice?
yes, that is an awesome organization. We wanted to come together and be able to help ladies to be there. We kind of have an angel's touch. That's what we have. And we find a lot of times people don't like to come into support groups, like in a group settings. They like to do one-on-one. So we do one-on-one, and then we have a group setting. Right, well now it's virtual. And support groups are good for healing, for women healing through that. Not only through that, whatever you're going through, if you get into a group, somebody's has lost their child, and then all of them, are like that. But the breast cancer organization, we come together and we share and we talk. We have people from the community come and talk through it. So it's real important to have the support group to help you through this journey, to understand what you're going through. It wasn't until I came in contact with another survivor that it all came together, even though my family was good support for me and my friends. But it wasn't until I came in contact with another survivor that I was able to kind of calm down. I didn't feel so alone. I could share my feelings. I could share things, and they knew. So then I was able to move forward toward my healing. And so that's how Angels came about, to be able to help more ladies to get through this journey.
That sounds great. Let's take a break, and we'll be right back with Janice and Dr. Richmond.
We'll be right back to the Cam Hill Show after these messages.
Houston's only Cadillac to your door dealer, Ron Carter Cadillac, delivers test drives to your home or office. For a limited time, get $16,000 off all in-stock Cadillac 2019 XT5 crossovers and $19,000 off all in-stock 2019 CT6 sedans. Or experience the first ever 2020 Cadillac XT6 Premium Luxury Collection. Only $519 with $1 down for 39 months lease. Or purchase and receive 0.9% APR for 72 months with no payments until November. RonCarterCadillac.com.
When it comes to protecting yourself and your partners, all the information out there can be overwhelming. Visit our website. We are a free and confidential service striving to help you stay informed and stay notified. We are committed to a healthy Houston.
Houston's only Cadillac to your door dealer, Ron Carter Cadillac, delivers test drives to your home or office. Drive the new 2020 Cadillac XT4, only $399 a month, or the new 2020 XT5, only $429 a month, both for 39 months lease with just $1 down. Or purchase the XT4 or XT5 and enjoy 0.9% APR for 72 months with no payments until November. RonCarterCadillac.com.
Have you been injured in an 18-wheeler accident, truck accident, car accident? Was someone texting and ran into the back of you, not paying attention? It doesn't matter what it is. Give me a call, Attorney Willie Powles. We'll fix it today. The number is 281-881-2457. Again, that number is 281-881-2457. We'll fix it today. Call Attorney Willie Powles.
And now back to the Cam Hill Show.
Hey, thank you so much for coming back. We're with Janice and Dr. Richmond, and we were just talking about angels surviving cancer. Dr. Richmond, let's go to you. You being on the advisory board, why did you decide to take that spot for Angels Surviving Cancer, that organization?
I decided to take that spot because a really good friend of mine who is a pathologist, she's in a different specialty in medicine, said, hey, you might want to check out this organization. Their goals and their mission aligns with yours. And so she introduced me to Mrs. Walkoff, and it's probably been about 3 or 4 years now. And of course, as I mentioned before, my grandmother was a breast cancer survivor. And I wonder if she had the support of a group such as Angels Surviving Cancer, if it would have been a little bit different, if her experience would have been a little bit better. And certainly at that time, I was working at Baylor in the Harris Health System, and we could use all the support that we could get. So I would refer my patients and people around me, women around me who I thought could benefit from the organization.
I love that. I love that. I will brag a little bit about Janice. She won't say it, but I know for a fact that Janice has come out of her own pocket and helped a lot of women, not for just going to get mammograms, but utility bills, food. She has paid, rent. She's helped them over and over again. So I know that to be true because, as she's always said, after 32 years of surviving, she has seen thousands of women. Yes. She has, and I'm right. Janice won't say it, but I've seen it for myself what she's done in Harris County
truth,
and Fort Bend. It's the truth. Yeah. Women call her late at night, 10 o'clock, she in a car driving. Where you going, Dan? Yes. Oh, I'm going to go talk to some, because she knows what it is at that time. She knows someone's stress. She knows anxiety, because it's anxiety, I know, when you're first hearing this. Because we always say, when we hear the word C, that word cancer, we automatically think death.
It's a death sentence. And it's not. That's the great part about it. It's not. And you can thrive. And I meant to say earlier, it's so many, we were talking about reconstruction and having mastectomies. There's so many advances in reconstruction, in treatment, and even in prevention. There's so many different advances. And so it's not a death sentence. It's an opportunity to take control and do what you need to do to maximize your health. And Ms. Janice, I can tell you, I agree, Cam. It will be times she's like, "Hey, Dr. Richmond, this patient is going to Harris Health. How can I get in with them?"
Yes.
I'm going to.
Yes.
Absolutely. She's like, I'm
Yeah,
going to.
yeah.
Who we
She
need to
does.
call?
Yes. She does. I'm telling you, she's true advocate.
That is a blessing to me
Yes.
because during that time, God told me that this is not unto death. This is going to be for you to help others.
Yes.
And so that's just such a passion to my heart. I know how it was hard for me.
Yes.
I didn't have anybody 32
Yes.
years. And so I want to be there. And now I have telemedicine where I can talk to the ladies. I want to be there. I really want to help them. That's just a love and a passion of mine, my purpose, my mission. It gets hard, but I just stay focused just to help the ladies. Thank you so much for recognizing that. But I want to be there for them. I'm sincere. When they call me, I'm there. And I got Dr. Richmond beside me, to get them through, to let them know, that you can get through this, get through it.
Absolutely.
Yes.
And I know that the Dr. Richmond and Janice, of course, 32 years later, look at how everything has changed. All the medicine, all the, the chemotherapy, radiation, just everything has changed now.
Yes, it's come a long way. It still has a long way to go. It has come a long way. I do think that they are explaining different things to the ladies better as far as the side effects of medication, different things like that. The chemo can always have improvement. I always think that. Yeah. And then, like you say, the disparities and the advocacy and different things, it still has a way to go. But yes, absolutely, it's come a long way.
Oh, I'm sure. Dr. Richmond, I know you've seen, just by you being in medicine, you know of the advances of things that have happened, just even after 4 or 5 years or 10 years or so.
Yes, and certainly we have another doctor on our board who is into research.
Yes.
And so I also always like to point this out as well, is that we have come a long way, but we certainly have a ways to go, particularly with triple negative breast cancer.
Yes.
And so basically that's the type of breast cancer where the usual treatment where we use medications to treat what we call receptors. These are areas in the tissue that take on hormones and can work a certain way, but with medications, it helps. But with Black women, particularly with triple negative, it means that these hormone receptors are not receptive to the treatment. And that's 3 different mechanisms, 3 different ways to treat. And those 3 ways are not met because the body just doesn't respond. And it's unfortunate, but we have a long way to go in that area as well. So I advocate we had a group session, was that about a month ago, Ms. WORKCUFF, where one of the ladies is she's in remission, and she went through a research trial and tried a new medication, and it worked. It absolutely worked. And had she not been in that process, it could have been a lot worse. So I do say we should start thinking about participating in research with a trusted researcher.
Yes.
Yeah.
Because we don't start talking about like Tuskegee and all of that. We have a lot of mistrust of the system. And I certainly understand that, right?
Right.
But we need to have we need to have that with trusted researchers, because we are getting left behind.
Yes.
People are getting advances in treatment every day, participating in studies, and we won't do it because of mistrust. And I understand that.
Yes.
Right.
Yes. I agree with that. Well, one lady had sent in an answer to one of them. She has had a double mastectomy, but she thought it to be a blessing because she reconstructed bigger, she said. She got... She sent in a note to let us know that she went 2 sizes higher than what she was.
Oh, that's
so she's fine.
So she enjoyed that.
She wanted to throw that in. But I do want women to know that your femininity is still there.
It's still
the
there.
Real men, gentlemen like us, or we believe in who you, the person, are, no matter about the body parts. I mean, we could lose parts too. I mean, you know us.
Or they might stop working.
Yeah. Wait a minute. Dr. Richard kind of threw something in there. Wait a minute.
She threw that one in there.
She did.
Yeah.
Let's tell about your event, Janice. You have an event coming up.
We do. It has just been such a burden on my heart. 2 years ago, Lord laid on my heart to do a symposium, a conference, and then with this, I wanted to reach a lot of people all over the world. So now with the pandemic,
Yes.
I can do that virtually. I can do that virtually, and so I am bringing all the advisory doctors together. Even our accountant, she's going to talk about financial part, and then I'm bringing a special guest, holistic doctor, Dr. Fisher's going to come. We're going to do a symposium on a Saturday. So we blocked out enough time where they can take time and they can talk education, they can answer questions. And I believe that education is important and it has not to a lot of people that need to get it. So this is just awesome. It is free. Donations are accepted and all the information is have that for it. But I just wanted that to be free. I really want them to get the education. I'm just excited about these physicians that are going to be given their time and given that information. It is so important to get the education. It is October the 17th from 11 to 1. And they can sign up on Eventbrite on our website at angelsurvivingcancer.net.
Dr. Richmond, let's give some words of wisdom to some of the ladies and the guys.
Yes. And yes. So it's universal advice for anyone is to make sure that you have a primary care doctor.
Yes.
It's so important because we're the gatekeepers. We can catch things early. We understand screening. We understand referring to providers if we're not able to do what needs to be done. And then we understand the overall, at least for me, the overall general whole person. So it's not just one part of the body that's affected, it's the whole body. And if we can prevent that, let's do. So if you have not had your wellness examination this year, get it done because the year is about to run out. And we talked about a little bit about insurance earlier, and new deductibles start again in January. That means that you may have to pay more money if you wait until the next year to get your examinations done. And so for my ladies, I say, hey, definitely advocate for yourself. We're seeing it all the time right now that no matter what your socioeconomic status is, no matter what your profession is, that we are not being listened to, and that things that could have been prevented and treated early are sometimes causing us death. So it's really, really important to advocate for yourself. And that would be my advice for today.
The other thing too, I don't want to be remiss about it. Some women are uninsured as well as underinsured. What do they do? If they fill in a lump, if something happens or they need, this is one thing that a lady just hit me with and said many women are not going because they don't know where to go when they're underinsured and uninsured.
Excuses.
So I'm sorry. Go ahead, Ms. Waka.
Yeah.
I was just going to say, okay, locally, we do have the Rose. We have a place where you can go and get your mammogram or your ultrasound done on a sliding scale system. So if you don't have any income, it will be free. And people like myself, I go there and get my mammogram done with my insurance because that helps to pay for a woman who does not have insurance. So that's for anyone. The Rose is an awesome resource in the community. And then you can also look at your local nonprofit organizations, or you can call Miss WorkCuff, you can call Miss Janice, and she's going to help you get it done. I can promise you that.
It's a resource.
Absolutely. Let's talk about that, Janice, and what you do with your organization. What does the organization do for women?
The ladies are very good. And as Dr. Richmond said, they can call the resources. If we cannot, we have a care program that help ladies that are going through that have to use all of their 401k, their savings and different things like that. We have a care program that helps them with their utilities, their rent, paying parking, different things like that. And then we have the scholarship program that helps the seniors that have lost their mother to breast cancer. We get scholarships for them. And so we help in support again, and we have mental health. We have Dr. Jones that is on board, and she is our clinical psychiatrist that helps also. So it's about resources. It's about finding out where you can get the information. will be able to help you because, like Dr. Richmond said, there's information and there's resources out there. You just need to be sure that you're connecting with the right people and calling, getting the information that you need.
That sounds good. Let's give a number out, Janice, for the Angels Surviving Cancer.
Yeah, the number is 281-912-5195. 281-912-5. I have to look at it. 5195.
That sounds good. Dr. Richmond, now I don't know if she's taking any more patients. Some people are asking if Dr. Richmond is taking patients. Dr.
Absolutely.
Richmond, how can people get in touch with you for family care?
Yes, absolutely. Yes, absolutely. I'm taking patients. And I wanted to say this too. I am doing in-person visits, but there's also the opportunity for telemedicine visits. So that's an opportunity for access where and you can pay a low cash rate to at least be face-to-face with the doctor, have them take a look at you and make recommendations. So yes, I am taking patients, and you can call 832-215-5985 and request an appointment. And my website is www.yourtotalhealthdoctor.com.
That sounds good. Let's give that number again, Janice, for Angels Surviving Cancer.
It's 281-912-5195. AngelsSurvivingCancer.net is our website.
Absolutely. And let's give that date of the event.
It's on October the 17th from 11 to 1, and it's virtual Zoom. And they can sign in on our website or on Eventbrite.
Absolutely. Dr. Richmond, they want your number again. They're writing it.
Okay. All right. Absolutely. It's 832-215-5985.
Let's say it again.
832-215-5985.
Ladies, I sure do appreciate you all for coming on the show and just giving, man, I'm excited because just learning just the differences with breast cancer, especially African-American women. I'm understanding that this is one of the top cancers for African-American women that many die from.
The second.
Yes.
Wow. That's something. Thank you, ladies. Thank you, Miss Janice, for everything you are doing 32 years later. God.
Just his work. Thank you. You're welcome. Thank you for having us.
I appreciate it. Dr. Richmond, I sure do thank you, lady, for coming on and giving the statistics and really helping us understand from a medical side. And we sure appreciate
Yes, my pleasure.
you. Thank you. And we will be back on tomorrow, 12:30 to 1:30. I appreciate you. Take care. Bye.